Okay, so you've got an annoying, nagging cough and you want to get rid of it quickly. How do you do it? There are several options you can consider when going to your local drugstore, but it can get confusing. So in this video, I'm going to make it very easy for you by explaining which ones are good choices and which ones are bad choices. My name is John Asani and I'm a licensed pharmacist in California. So let's just get right into it. First, let's go over some natural options. The main one is Vicks Vaporub. You take this ointment or whatever it is and you just rub it basically on your chest. Genius marketing, as the directions on how to use it are basically in the name. Anyway, the way it works is you rub a thick layer on your chest and neck, then the vapors enter your nose and reduce your cough. Vaporub contains camphor, which is a cough suppressant and pain reliever, eucalyptus oil, which is a cough suppressant, and menthol, which is mostly a pain reliever, but I guess works as a cough suppressant too, although I've never seen it really advertised as such. It has some inactive ingredients, but those three I mentioned are the only things that actually have an effect on the body. Now, camphor is a natural occurring product. It's just synthetically made in this product. Now, this product is not something I typically recommend for patients unless they insist on absolutely nothing going inside of their mouth for whatever reason. That is basically the only reason I would consider recommending this product. It is inferior to all other products I will mention in this video. It can work, but honestly, I would just skip it and use something else instead of rubbing this ointment on your chest 3 to 4 times a day. Something that is quite effective is dextromethorphan. This is strictly a cough suppressant that will basically tell your brain to stop coughing. That's how it works. Very simple. However, I don't normally recommend dextromethorphan by itself. I like to combine it with guaifenesin. Guaifenesin is an expectorant which will loosen up the mucus and make sure you're coughing it out so it doesn't just stay in the lungs. The reason why this combination is effective is because the cough suppressant dextromethorphan will reduce the amount of coughs, and the guaifenesin will make sure that the few times you do cough, it'll contain mucus that you can just spit out. You don't want a dry cough, as that will be an unproductive cough and will irritate your throat and get nothing done. Robitussin and Mucinex are the brand names for guaifenesin, and Delsym is the brand name for dextromethorphan. Robitussin DM contains both guaifenesin and dextromethorphan, so that is typically the one I recommend, as I mentioned earlier. However, I don't care for the brand name. I always buy generic, and that's what I always recommend as well. Just look in the back of the label at the active ingredients section and make sure it has both expectorant guaifenesin and cough suppressant dextromethorphan, and you should be good to go. Now, there are clearly products like DayQuil, NyQuil, and Theraflu that are combination products that contain 3 or 4 ingredients that do a bunch of different stuff. However, I don't normally recommend these because you want to tackle each symptom individually as they come. Normally, during a cold or flu, the symptoms come one by one or 2 at a time, so you don't usually have a headache, sore throat, cough, congestion, fever, all at the same time. So a combo product doesn't really make sense to have lying around, and they're overpriced in the long run. Buy the individual generic versions for each symptom and take them only when you specifically want to get rid of that symptom. DayQuil, for example, has a pain reliever, cough suppressant, no expectorant, with a completely useless decongestant called phenylephrine. Why take this product if you only have a cough? You don't need fever reduction or decongestion or pain relief or whatever. You just need to suppress your coughs, which this product doesn't even do very well because it doesn't have the expectorant. So just get a separate product containing both guaifenesin and dextromethorphan, preferably in liquid form because liquids are easier to swallow than pills when you have a cough or cold or just aren't feeling very well overall. Now, there are cough drops. These are okay for quick relief, especially if you're on the go, but I wouldn't really recommend these at all if you're laying in bed with a nasty cough. These are just mainly for those annoying few cough spurts you may have that you want to eliminate quickly. And if you're out and about, it's much easier to just pop in a cough drop than carry a liquid around with you the entire time in your pocket. Okay, now to some prescription options. The main one being promethazine DM. This is common from physicians to prescribe for their patients that are dealing with a cough. This is a pretty effective cough suppressant, but honestly, not much more effective than guaifenesin and dextromethorphan. Promethazine DM has both promethazine and dextromethorphan, and its main benefit is that it can suppress your cough and help you sleep because it can cause drowsiness. Promethazine is an antihistamine which can make you drowsy, so it's useful to take before sleeping. This will be a decent option to take at night, but honestly you can just use dextromethorphan and guaifenesin every 6 hours, and if you need to sleep, take some diphenhydramine, which is the generic for Benadryl. It's similar to promethazine as it is a first generation antihistamine and will make you drowsy. The benefit of these three together is that none of them require a prescription in the United States. So you can just walk into any pharmacy and pick it up and be good to go. You don't have to call your doctor for a promethazine DM. There's also promethazine with codeine, which is a controlled substance, and I don't see this used very frequently because of its potential to be abused, and I would not recommend this product for a cough anyway. Promethazine by itself isn't great at reducing cough symptoms, and the codeine is good for reducing pain, not cough, so not really effective there. It's not very useful even for its intended purpose. A prescription option that is very good, especially for completely stopping a dry cough, is benzonatate. This is a very small yellow clearish capsule that is pretty effective. A few years ago I had a dry cough that lingered for months, and every now and then I would have an insane cough attack where I would just cough for 4 to 5 minutes straight. It was a nightmare. But I got prescribed benzonatate and it completely stopped my cough from happening. But it is prescription and normally won't be prescribed during a cough. It's mostly just used for those annoying, lingering dry coughs that have been going on for months. Okay, so to recap, the best option for treating cough symptoms is a combination product of guaifenesin and dextromethorphan, preferably in liquid form, but pill form is okay too if you don't mind. Next best option is promethazine DM, but you need a prescription and it will make you drowsy. Vicks Vaporub if you just want to smell the treatment, and benzonatate if you have a lingering cough that is dry, no mucus. I would not recommend guaifenesin on its own or dextromethorphan on its own, cough drops, all-in-one products like DayQuil, NyQuil, or Theraflu, or promethazine with codeine, as those are not the most effective and safe options on the market.